Colombo, News First. The Allergy, Immunology and Cell Biology Unit of the University of Sri Jayewardenapura warned there is a risk of monkeypox entering Sri Lanka. Dr. Chamdima Jeewarandara told News First that as the symptoms of monkeypox is visible, it is easy to identify the infected cases, adding that the spread is far less than what was experienced with COVID-19. The World Health Organization has activated its highest alert level for the growing monkeypox outbreak, declaring the virus a public health emergency of international concern. The rare designation means the WHO now views the outbreak as a significant enough threat to global health that a coordinated international response is needed to prevent the virus from spreading further and potentially escalating into a pandemic. Although the declaration does not impose requirements on national governments, it serves as an urgent call for action. The WHO can only issue guidance and recommendations to its member states, not mandates. Member states are required to report events that pose a threat to global health. The UN agency declined last month to declare a global emergency in response to monkeypox. But infections have increased substantially over the past several weeks, pushing WHO Director General Tedros Adhanom Ghebreyesus to issue the highest alert. Before a global health emergency is declared, the WHO's Emergency Committee meets to weigh the evidence and make a recommendation to the Director General. The committee was unable to reach a consensus on whether monkeypox constitutes an emergency. Tedros, as the WHO's chief, made the decision to issue the highest alert based on the rapid spread of the outbreak around the world. "We have an outbreak that has spread around the world rapidly, through new modes of transmission, about which we understand too little," Tedros said. "For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern." More than 16,000 cases of monkeypox have been reported across more than 70 countries so far this year, and the number of confirmed infections rose 77% from late June through early July, according to WHO data. Men who have sex with men are currently at highest risk of infection. 5 deaths from the virus have been reported in Africa this year. No deaths have been reported outside Africa so far. Most people are recovering from monkeypox in 2 to 4 weeks, according to the U.S. Centers for Disease Control and Prevention. The virus causes a rash that can spread over the body. People who have caught the virus said the rash, which looks like pimples or blisters, can be very painful. The current monkeypox outbreak is highly unusual because it is spreading widely in North American and European nations where the virus is not usually found. Historically, monkeypox has spread at low levels in remote parts of West and Central Africa where rodents and other animals carried the virus. Europe is currently the global epicenter of the outbreak, reporting more than 80% of confirmed infections worldwide in 2022. The U.S. has reported more than 2,500 monkeypox cases so far across 44 states, Washington, D.C., and Puerto Rico. Tedros said the risk posed by monkeypox is moderate globally, but the threat is high in Europe. "There's clearly a risk that the virus will continue to spread around the world," he said, though it's unlikely to disrupt global trade or travel right now. In early May, the United Kingdom reported a case of monkeypox in a person who recently returned from travel to Nigeria. Several days later, the UK reported 3 more cases of monkeypox in people who appeared to have become infected locally. Other European nations, Canada and the US then also began confirming cases. It's unclear where the outbreak actually began. The WHO last issued a global health emergency in January 2020 in response to the COVID-19 outbreak and 2 months later declared it a pandemic. The WHO has no official process to declare a pandemic under its organizational laws, which means the term is loosely defined. In 2020, the agency declared COVID a pandemic in an effort to warn complacent governments about the alarming levels of spread and severity of the virus. The WHO's lead expert on monkeypox, Dr. Rosamund Lewis, told reporters in May that the UN Health Agency was not concerned about monkeypox causing a global pandemic. She said public health authorities had a window of opportunity to contain the outbreak. But infectious disease experts are concerned that health authorities have failed to contain the outbreak, and monkeypox will permanently take root in countries where the virus wasn't previously found with the exception of isolated cases linked to travel.